Good morning. My name is May Malye. I am thrilled to welcome you to our training program for newly hired company nurses regarding occupational health and safety. I serve as a training officer for company nurses and I will be your trainer throughout this orientation and training period. So first and foremost, congratulations on joining our team. Your role as a company nurse is crucial to maintaining the health, safety, and well-being of our employees. We recognize the unique skills and perspectives you bring, and we are committed to supporting you as you transition into your new role. To give you a bit of background about myself, I have been a company nurse for 3 years and have specialized in occupational health, ergonomics, and infection control. Throughout my career, I have had the privilege of working in various healthcare settings, and I'm passionate about education and mentoring. The primary goal of this training is to equip you with the knowledge and skills necessary to excel in your role as a company nurse. Today, we will cover an essential topic about workplace health and safety, ergonomics, and injury prevention. Our training will follow a structured approach to ensure you get the most out of each session. Throughout this training, I will be here to support you every step of the way. Please do not hesitate to ask questions, seek clarification, or request additional help if needed. We will also provide you with various resources, including training manuals, videos, and access to experienced colleagues who can offer further guidance. We will begin today with an introduction to workplace health and safety, focusing on ergonomics and injury prevention. This topic is crucial because it helps prevent common workplace injuries and promotes a healthy work environment, which ultimately enhances productivity and employee satisfaction. The general objective of this orientation is to be knowledgeable about the importance of workplace ergonomics and injury prevention to ensure a healthy and safe work environment for all employees. The specific objectives of this training is to number one, to provide you with the knowledge and skills necessary to maintain workplace health and safety through the application of ergonomic principles and injury prevention techniques. Number two, understand the principles of ergonomics. Number three, recognize common workplace injuries. Number four, implement ergonomic workstation setup. Number five, practice proper lifting techniques. Number six, perform injury prevention exercises. And lastly is to understand the long-term benefits of ergonomics and injury prevention for health and productivity. So after this training, I will conduct an assessment where each nurse demonstrates the correct ergonomic setup and lifting techniques. Our resources that are we going to use are ergonomic assessment tools, visual aids, and practice materials. So once again, welcome to the team. I am excited to work with each of you and help you develop the skills necessary to thrive in your new roles. So let's embark on this learning journey together and make it productive and enjoyable experience. Thank you and let's get started. Let's begin first by defining what is ergonomics and its importance. So ergonomics is the study of designing equipment and devices that fit the human body and its cognitive abilities. It is also critical to reducing workplace injuries and improving employee productivity and well-being. Let's discuss the principles of ergonomics. So number one, fit the task to the person. So this is to design workstations and tasks that match the user's physical capabilities and limitations. Number two is posture and movement. So this is to encourage neutral body positions and frequent changes in posture to reduce strain. Number three is to minimize repetitive movements. This is design tasks that minimize repetitive motions and allow for variety in activities. Number four, use proper equipment. Ensure that tools and equipment are designed for safe and efficient use. And lastly, the environmental factors, which is to optimize lighting, noise levels, and temperature to enhance comfort and reduce strain. What are the benefits of ergonomics? It reduces risk of injury, it increases productivity, and it enhances employee comfort and satisfaction. So, what are the causes of common injuries in workplace? Number one, poor posture. This includes slouching, improper chair height, and inadequate lumbar support. Number two, repetitive movements. This includes continuous typing, repetitive lifting, and constant use of certain tools. Lastly, incorrect lifting techniques, which is the bending at the waist instead of the knees, lifting heavy objects without assistance. So let's discuss what are the health impacts of poor ergonomics on employee health and productivity. Number one is musculoskeletal disorders. So these are injuries or disorders that affect the body's movement or musculoskeletal system. These are the muscles, tendons, ligaments, nerves, discs, and blood vessels. Examples: back pain, neck strain, and tendonitis. Number two is the repetitive strain injuries. So these are injuries caused by repetitive tasks, forceful exertions, vibrations, mechanical compression, or sustained awkward positions. So example of this is the carpal tunnel syndrome or tennis elbow. Number three, back injuries. These causes improper lifting techniques, poor posture, prolonged sitting. The symptoms includes pain, stiffness, and reduced mobility. Number four, carpal tunnel syndrome causes repetitive hand and wrist movements and poor wrist posture. The symptoms, these are numbness, tingling, pain in the hand and fingers. Next is visual strain. So it is the strain on the eyes due to poor lighting, improper monitor placement, and prolonged screen time. This example includes computer vision syndrome and dry eyes. Lastly, fatigue, physical and mental exhaustion resulting from poor posture, repetitive tasks, and uncomfortable working conditions. So example is generalized body fatigue and mental fatigue. So what are the impacts of poor ergonomics on employee productivity? Number one, decreased efficiency. Poor ergonomics can slow down work processes due to discomfort and pain. Examples, reduced typing speed or slower movement due to pain. So the employee will have longer task completion times or decreased output. Next is increased error rates. Discomfort and pain can lead to decreased concentration and increased mistakes. Examples, data entry errors or misfiled documents. So this will result to increased error frequency or lower quality of work. Lastly, higher absenteeism. Health issues resulting from poor ergonomics can lead to more sick days. Examples, absences due to back pain or doctor's appointments. So, employee will frequent absences and increased use of sick leave. I will play a step-by-step 3 minutes video on setting up an ergonomic workstation. So this includes your chair, desk, monitor, keyboard, and mouse.
Here's your desk, your chair, monitor, keyboard, mouse, phone, a plant? Sure. Problem is, your desk isn't really built for you. It's for anyone. Spending 8 hours a day reaching, slouching, or craning can lead to pain. At least that's what John Sinkay from the Hospital for Special Surgery says.
I do say that every day.
So he's here to, well, he can tell you.
I'm here to show you how to set up your desk ergonomically so you can avoid pain later on in life. Step 1, adjust your chair. The average desk height is 29 to 30 inches tall. For some, this could be too tall or too short. That's where your chair comes in. The first thing you want to do is adjust the height. When you do, make sure your elbows are bent to 90 degrees. So if a person's feet are not touching the floor, this could become an issue. So we're going to give her a footstool. If you don't have access to a footrest, we recommend using a ream of paper. Step 2 is adjust your monitor. The tip is to have the monitor close enough, about arm's length, so so you're able to read without having to strain your eyes or to bend forward and adjust your posture. So what you want to do is raise the monitor up till the top of the screen is eye level. If your monitor is not adjustable in height, use your reams of paper. Much better. If you work from two monitors, consider how you use them. If you have a primary monitor, you want that directly in front of you. If you use both monitors equally, you want them lined up so you are in the middle of the two. For a laptop, you want to use a kickstand to raise the screen up to the proper height. Then you can attach an external keyboard and mouse to it. Step number 3 is to mind your mouse and your keyboard. Where your hands end up is where your keyboard should be. Your mouse should end up right next to your keyboard. You want to move from your elbow instead of your shoulder to prevent overuse or strain or pain. The key is not to reach for your tools. Step 4 is to position your phone. You want to put the phone on your non-writing side so you don't have to cradle it to your shoulder. This could eventually lead to neck pain. If you're on the phone a good portion of your day, you want to consider using a headset. That way your hands are free to write down anything or to type on the computer. Step 5, move. After 10-15 minutes, we all begin to slouch in our chairs. So here are some basic exercises you can do while sitting in your chair. The first exercise is a chin tuck. The second exercise is for your upper traps. You're going to do a basic stretch where you bend your head to one side and then gently pull for a little more oomph. The third exercise is called a scapular retraction. You basically are going to squeeze your shoulders back. The fourth exercise is for your lower back. This is what we call a pelvic tilt. The most important thing you want to do is get up out of your chair every hour. Get up and walk. Get something to eat. Get something to drink. Just get up.
John, are we done?
Yeah, we're good.
Great.
Next video is about the proper lifting techniques using ergonomic principles. So this is a 2 minutes video. So let's watch.
Hello, my name is Mark Matzik. I'm a physical therapist at Huntsville Hospital. This video that you're about to see is extremely important to help you prevent getting injuries and show proper biomechanics that you can use at work and at home so you don't have any injuries. You can prevent injuries by using simple body mechanics when lifting or moving objects. But before you lift, stop and think. Is the object too big for you to lift? Will it be too heavy? Can you remove some of the contents to make it lighter? And if you need help, ask for it. When you lift an object, like a box, start by positioning your body as close to the object as possible and straddle your legs. Be sure to use your legs to lift, not your back. And when you are placing an object on a high shelf, position yourself as close to the shelf as possible so you don't have to reach to place the object. For picking up light objects off the floor or a lower shelf, use the golfer T-lift. With one hand on a secure structure, bend forward while allowing one leg to lift off the floor. This gives you a counterbalance and relieves the pressure from your lower back. It's just as important to use proper body mechanics when you are moving an object. Even if there's not much lifting involved, make sure you pivot your body by moving your feet instead of twisting at your waist. You also want to always push instead of pull whenever possible. With more control and better body positioning, pushing means less injuries.
Let's see some exercises to prevent repetitive strain injuries. Okay, so let's try to do the exercises in the screen while on your desk. So first, stretch the arm, palms facing outward. Okay, great. Next is stretch the arm above your head. Then again, palms facing outward. Okay, you're doing good. Next is, let's try placing the arms at the back of your head and stretch. Okay, good job. Okay, next, up and down shoulders. Good. Next, bend the head sideways. Great. Next is interlap your palms in front of your chest facing upward. Okay. Next is facing downward. How about we raise the left arm and do the same with the right? Okay, doing good. Then twist your body while your legs are crossed. And then stretch your back. Okay. And then shake your arms and shoulders and upper body. Okay, that's it. So, did you feel your muscles relax? Okay. Okay, so let's proceed to the next topic. What are the long-term health benefits of reducing workplace injuries and improving employee productivity and well-being? So number one, prevention of chronic conditions. So regular attention to ergonomics can prevent long-term conditions such as chronic back pain, carpal tunnel syndrome, and other musculoskeletal disorders. So sustain work comfort and well-being. A comfortable work environment reduces physical strain and fatigue, promoting overall well-being. Efficiency and performance. So ergonomic practices can increase efficiency by reducing discomfort and the need for frequent breaks, leading to better performance. Next is reduce absenteeism. So, preventing injuries decreases the likelihood of 6 days, ensuring consistent workforce availability. And also safety culture. So, by creating a safe workplace, by prioritizing ergonomics and injury prevention, you contribute to a culture of safety that values employee health. So, as a role model, as nurses, you set an example for other employees by demonstrating best practices in workplace health and safety. So, by following this strategy, you will gain essential skills in workplace ergonomics and injury prevention, ensuring they are well prepared to promote a healthy and safe work environment for all employees. And that will end our training for today. Are there any questions? None? Okay. So I would like to emphasize again the importance of ergonomics and injury prevention in daily work. These are not just one-time activities but should be integrated in your daily work routine. So consistent application of ergonomic principles helps maintain long-term health and productivity. So thank you for your participation. Good day.